Janet Sugut. I head the facility as the Chief Medical Officer. Welcome to our newest branch. This is Foutain Healthcare Nairobi, Kahawa Sukari branch. We have 2 hospitals in Eldoret and Bungoma. And so this is our newest baby. And I welcome everyone to seek services in this facility. We opened our doors in January of 2020. We offer general consultation. We have our resident medical officer who is here all the days of the week. We have laboratory and pharmacy services, and we offer holistic care, which is actually the motto of the Foutain Healthcare as a whole. We also have obstetrics and gynecology consultants, and they're actually 2 in number. We have a family physician on board, we have a surgeon on board, and in the next few months we'll be having a pediatrician on board to take care of your needs. Also in the next few months we will be having MCH, which is basically mother and child. So for your family planning services, for your immunizations, you will all have it here in one house. Our hope is that by the end of December, by the end of this year, actually in December, we shall have dental services up and running to take care of your oral health. So we are a primary healthcare facility. So basically, we do primary healthcare, and our hope is that we grow together as we make each other better. We take care of your needs, and we grow together as a community. Thank you very much. I welcome all of you. We are open Monday to Saturday for now, but in the next few months we will be open all the days of the week. Karibuni sana. Maybe I should mention that also in our plans is to have radiology services. So we'll have an X-ray and an ultrasound coming. What will come first is an ultrasound machine. So for all your ultrasound needs, you should be able to get it at Foutain Healthcare House Okari. Thank you very much and welcome all of you. Thank you. So today I want to teach us to talk about stroke, which is becoming a very common disease or a condition. And in simple terms, stroke is like a brain attack. The way you'd have a heart attack, you can also have a brain attack, which in scientific terms we call it stroke. So there are 2 types of stroke. There is ischemic stroke and hemorrhagic stroke. Just to make that simple, ischemic stroke is when a vessel is blocked, and so a part of the brain does not get blood. And hemorrhagic stroke is when a vessel bursts and pours blood into your brain. And there could be many reasons. It could be because of trauma, so when you've been in an accident and you rupture one of the vessels in your brain. It could also be because of common things which are actually becoming common nowadays. Is hypertension, and it's on the rise according to data. Hypertension and diabetes. So what it does is it makes your vessels weak, and so when you have, at any point when you have very high levels of high blood pressure, the vessels could rupture and you get a stroke. Now, interestingly, data shows that 80% of the strokes are actually preventable. And I say this because the most common causes are the lifestyle diseases, or the NCDs as we put it, non-communicable diseases, which are on the rise in the past few months and years. Hypertension and diabetes, and especially are associated with lifestyle, are actually lifestyle diseases. And so if we modify our lifestyle, that means we prevent getting diabetes and hypertension, and in turn prevent getting the strokes. There are modifiable risk factors and there are non-modifiable risk factors. So non-modifiable are things that you cannot change, like your age, where you come from, your family, ethnicity, and all. But there are modifiable risk factors. That means things that you can do something about. So some of the risk factors for stroke is having hypertension and diabetes. Like I said, those are lifestyle diseases. Because of sedentary lifestyle, because of eating unhealthy diets, high-fat diets, high-salt diets, all of those can lead you to have diabetes and hypertension. The other thing is smoking, drinking alcohol, obesity, which again goes with sedentary lifestyle. So a lifestyle where we are just eating and we are not exercising will make us be obese, and will in turn, it's a ton of events, and in turn you will get diabetes, hypertension, and the consequences at the end of it could be a stroke. And anybody can get a stroke, from the young to the old, depending with your risk factors. So just so that we learn the signs and symptoms, I'm not going to be scientific. In very simple terms, we are going to use 4 words. It's called FAST. F-A-S-T. So FAST, F stands for face droop. So when you see someone and they try to smile and half of the face is not balanced, that's called a face droop. It's one of the signs of stroke. The other is arm weakness. So you ask someone to stretch their arms and one of them drops. So that is also a sign that someone could be having a stroke. The other one is speech difficulties. So someone speaks, okay, and then in the next few hours they're having slurred speech. It could be that they're having a stroke. Those are the common signs. And T is time. They say time is brain. Or rather, brain is time, whichever way you want to look at it. And what that means is there's a certain period of time where you can intervene in a stroke. Scientists tell us within 3 hours, if you present to hospital within 3 hours, then the effects of stroke can be reversed. So what happens when a part of your brain is not getting oxygen? It means that part dies. So that means your brain dies, okay, and you're left with disabilities. The brain has many functions. There are different parts that do different things. So again, it depends where the stroke has hit. And whatever disability you get is dependent on what part of the brain has been affected. And so if you're within the acceptable window period, then the stroke effects can be reversed. And that is why we say brain is time, or time is brain. So if you see someone with a face droop, arm drifting, and slurred speech, kindly call an ambulance. And I'm encouraging all of us to make use of ambulances, because these are people who've been trained in pre-hospital care. They're able to initiate treatment for stroke even while on transit to hospital, and increases your chances of not getting disability from it. And they also will take you to a hospital that is able to intervene within those acceptable time periods. So there are two ambulance services currently in the country, as even as we try and build an emergency care system. We have Rescue and A+, and their numbers are out there. We'll be able to share in our page as well. In case of any emergency, you need to call. So stroke is one of them. So there are other signs. The 3 that I've talked about are the common signs, but there are other signs. You can have severe headache. You can have imbalance when walking. You can also have difficulty seeing in one eye, numbness of the face, and also you can have confusion. Acute confusion could be a sign of stroke. So we just should be aware of the other signs of stroke as well. So what should you do when you think someone has stroke? Because the chances of survival depends on you being able to identify that someone has a stroke, possible stroke, and doing the right thing. So once you think someone could be having a stroke, the first thing you do is call an ambulance, who will then take you to a facility that is able to intervene. And when you reach there, your doctor will have to diagnose. Like I said, there are two types. So how we diagnose is doing brain scan. Okay, so we image your brain. So there are two ways we can do it. You can use a CT scan, which is normally faster, and you can do an MRI. In practice, we do a CT scans initially. It helps to differentiate between ischemic stroke, the one the blood vessel is blocked, and hemorrhagic stroke, the one that a vessel has burst and poured blood into the brain. So there will be two different ways of handling that. So if you're having ischemic stroke, if you're within the intervention period, the doctor can try and release the clot. So there are different ways that can be done. So they can use drugs to break the clots, or they can use some minor surgical procedures, interventional procedures. So either of those procedures can be done to release the clot, and what that does is it opens up that vessel, and you're able to get perfusion to your brain. So meaning the part that was not able to get oxygen is now able to get oxygen. And if you have hemorrhagic stroke, now that is dependent. It depends with how bad the bleed is and where it is. And most of the intervention for hemorrhagic stroke would be surgical intervention, which means they take you to theater and they open up your brain and they drain it. Okay. So if you're outside of the intervention period, then there are other things that can be done. So there are medications you can be given to prevent you from getting recurrent strokes. Data shows that if you get one stroke, there's a likelihood of getting another stroke. So once we are unable to prevent that stroke at a particular time, we prevent you from getting more strokes. And so there are treatments that we give you in the acute setting. And again, the other thing we do is rehabilitation. So say you're outside of that period, you've come to hospital 10 hours, 20 hours later, and we cannot reperfuse your brain, then we can do rehabilitation. So what stroke does, like I said before, is you lose function. And so the purpose for rehabilitation is to make you able to function. And there are three phases of rehabilitation, or three arms. We have physiotherapy, which will help you regain muscle strength, because ideally one of the parts of your body becomes weak. So physiotherapy makes the muscles in that part of your body be strong, and you're able to walk again or hold again. The other arm is speech therapy. Some people will lose speech ability, or even being able to eat. And what speech therapists do is take you through some steps that will help you regain your speech. And it's a slow process. There's no defined period really when you regain those functions, but it's a walk in the park. It's a slow journey, but eventually some people regain at least most of the functions. And the last one is occupational therapy, which basically they train you how to do your daily activities, how to dress, how to shower, That's basically what occupational therapy is. And at this point, I want to, from my practice, the most common scenarios I get is when people come in and they're young people and they have hemorrhagic strokes and they have very severe bleeds in their brain. And when you get the history is always, I did not use my hypertensive drugs well in the past few months. And it's a very common cause for having hemorrhagic stroke, you not being able to use your medications. Because what happens, the blood pressure goes very high, you burst a vessel. And some come to us when we really can't do much because the bleed is so much, the brain is so damaged. And it makes me very sad because these are young people. We're losing young people who would otherwise be productive and taking care of their family. And that brings me to prevention. I said before, NCDs are on the rise, and it's because of sedentary lifestyle. There are so many joints that sell fast foods. They say this generation loves things that, we're very fast. We are not very patient. Our parents maybe used to cook githeri for so long, and we're not that patient. We want to get to a fast food and take some fries and chicken and go home. And eventually these things build up. I mean, you get the effects from around 40s, 50s is when you realize, oh, your cholesterol is high, your blood pressure is high, you now have diabetes, you're obese. And that's when you start having all these complications. So for you to prevent diabetes and hypertension, and eventually also complications like stroke, we need to eat healthy. We need to eat healthy. We need to teach our children to eat healthy. And if you teach them when they are at a younger age, then they grow knowing that the healthy food is good. So things like a lot of vegetables, a lot of fruits, low salt diets, okay, low sodium diets, low fat diets as well, should make a bigger part of your diet. The other thing is physical activity. We advise 30 minutes at least 3 to 4 times a week of 30 minutes of. We advise 30 minutes 3 to 4 times a week of exercise. Yes, and that means you're doing exercise to break a sweat. Like, you should sweat. You shouldn't just walk to feel comfortable. You should actually be able to sweat it out, and that's how you burn cholesterol. That's how you burn fat. And again, this should be inculcated even at a younger age, at an early age, so that people can make it a habit to do exercise. Limit alcohol, avoid smoking, and at any point, if you're diagnosed to have diabetes and hypertension or cholesterol, your high cholesterol levels, and you're put on treatment, my urge is that you need to be compliant with your treatment. It has been shown that if you're actually compliant with your treatment and your blood pressure and diabetes are at target, the risk of getting complications becomes way less. And stroke is just one of them. There is heart attack, which we all know. In scientific terms, is acute coronary syndrome or myocardial infarction. And there's also kidney failure. So if you control your sugar and diabetes, the risk of getting kidney failure decreases remarkably. So basically that's it about stroke. So here in Foutain, we have doctors who can take care of you, who can advise you further regarding healthy living, a healthy lifestyle, and I hope that we can engage more. If you have any questions, we can always answer your questions.